There's a common theme across breast cancer awareness campaigns. Almost the majority of the materials feature or highlight adult women. In fact, searching breast cancer patient on Google Images will yield more photos of adult women than any other demographic. The fact is, most cases of breast cancer develop among women ages 40 and above. But it goes without saying, men and younger women also have breast tissue. They share similar structures and therefore, similar health risks. Which means, no matter who you are and how old you aren't an exception to breast cancer. Breast cancer happens when normal breast cells start growing abnormally, faster than healthy cells do. They start clumping together, forming a lump in the affected area. It affects at least 1 in 8 women, which is why it's traditionally thought of as something that could only happen to women in late adulthood. As a result, those outside this demographic brush off the possibility of breast cancer, despite noticing something wrong or having a high risk of getting it. We talked to Doc Jen, Dr. Ajoy, and Paula to get a glimpse into their experiences with breast cancer.
My initial understanding of cancer in general was that it wouldn't happen to me. It wouldn't happen to someone in my family. It was always something that you read about that's happened to other people. But after going through this myself, I realized that it can happen to anyone at any time.
Before my mom was diagnosed, I was really young back then. So I was only 12 years old, I think, when she was first diagnosed with cancer. But the biggest factor that I didn't think much of breast cancer or that my mom had the possibility to get breast cancer as well was because I never met my tita who had breast cancer.
I wasn't thinking that there's a possibility for someone as petite as me to have breast cancer. That's one. Second is, if you don't have any family history of breast cancer, there's a very minimal or almost a 0% na magkaka-breast cancer ka. That's another misconception on my part.
Many of us assume that your risk of breast cancer relies heavily on your family history. But that's not always the case. To debunk assumptions like these, we talked to Dr. Noriega, a breast cancer surgeon from Asian Hospital and Medical Center, and Dr. Helen Amo, an oncologist from Our Lady of Lourdes Hospital.
A lot of us think that we have to have a specific genetic mutation, no, or parang it is more of hereditary. Though in reality, only 5 to 10% of breast cancers are hereditary, and most of the breast cancers are sporadic, meaning it can occur in an abnormality in our genetic makeup because of simply aging and even because of other risk factors. Research actually shows that lifestyle change can actually decrease the risk of breast cancer even to those women who are at higher risk.
Which means, depending on your lifestyle, drinking, smoking, eating fatty food on the daily, even if breast cancer isn't in your family, your risk of getting it can increase, men and women alike.
In terms of symptoms, in terms of treatment, in terms of presentation, there's actually no difference between female breast cancer and male breast cancer. The main difference is that most male breast cancer patients are detected late.
Most men get checked when the symptoms have already gotten worse. These symptoms can manifest in anyone, regardless of sex or family history.
So in 2020, when doing a routine self-check on my chest, I felt a lump that had not been there before. So I immediately went and had the mammogram, had the biopsy, and had it tested. And it turned out to be breast cancer.
My initial reaction was denial. There's this lump. It's only around mga, siguro pea-size lang siya pero matigas siya, masakit, and very deep. Naramdaman ko siya sa left side. So I felt the other side, wala siya. It's not there.
You can easily look up breast cancer symptoms on Google. What you'll find are lists and articles talking about breast lumps, lumps on the armpit or neck, nipple discharge, inversion of the nipple, and abnormal rashes, what you probably won't find online.
But Google doesn't say that these symptoms are actually on the late side already. Okay? So that is why we as doctors, we're advocating screening rather than symptom-based problems.
Patients have better chances of surviving through hospital facilities and a combination of both early detection and early management.
It is very important that you perform self-breast examination monthly or on a regular basis.
Raise your arm. You can be lying, you can be upright, even taking a bath. Okay? So very important na sasalatin mo yung breast mo circumferentially, meaning from the axilla, kilikili, going around up to the nipple.
And after feeling all those parts, you also have to inspect closely the nipple and the areola and check for any nipple discharge. So you have to pinch your nipple after your examination.
The important thing is that a woman or a man should be familiar with the topography of one's breast, one's body, because this is the only way for you to discover any new lesion or any new problem that wasn't there before.
A more objective part of screening, we advocate naman doing clinical breast exam, no? That means you need to see a doctor regularly to have yourself checked and doing your diagnostic or screening mammograms.
Local hospitals are equipped with the technology and care needed to treat breast cancer, like hospitals from Metro Pacific Health, the leading and most valued integrated healthcare network in the Philippines, a one-stop shop for medical breast concerns.
Treatments include surgery, hormonal therapy, chemotherapy, your radiation therapy, and targeted therapy.
Lahat ng beses na nagkasakit ako, nagka-cancer ako, makatimed ako agad because I got the best care there from the doctors and nurses. So when I was diagnosed with stage 1, I immediately went to my doctors and I said, I would like the Angelina Jolie. Yun po yung tawag nila sa radical treatment na double mastectomy. It's not a decision that all women will take. A lot of them will opt to preserve their breasts, and I honor that. There are treatments for that. I think radiation is also applied in such cases, but I did not want to go through radiation. So that was a personal choice and decision I made.
I was positive for cancer cells in 1 out of 18. So it meant I had to go through chemotherapy. But as like other cancer patients, nag-isip pa rin ako. But I chose the one that is a shorter course and one I'm comfortable with, and one in the treatment that I believe that I can have better chances of surviving.
We actually decided to move her to Cardinal and change doctors. Although things weren't easy because of the situation, I think it really helped that we switched hospitals and that she was able to still receive good health care despite what she was going through.
Just because breast cancer awareness campaigns don't speak to you doesn't mean you should be complacent. Everyone and anyone should be cautious of their risk of breast cancer. But the good news is that it's no longer a death sentence. A healthy lifestyle and diet can lower your risk, as well as regular checkups with your trusted doctors.
One thing that I would regularly do is that every month I would make sure to check for lumps around my breast, do a breast examination on myself. I know that even if I'm still young, it's still possible.
Cancer is not a disease that you'll have to do the journey alone. Perhaps if I did my exam or I did the test even earlier or yung lifestyle ko, inayos ko na, maybe I could have skipped the other treatment. But once you're diagnosed, there are certain treatments that you really need to undergo. But you can do it with the help of the experts and with God's strength, with God's help. In a way, parang I look at my cancer as an eye-opener. Parang blessing in disguise. Kasi before I was diagnosed, I was restless. That cancer actually allowed me to pursue what I really wanted to do. I decided to finally write my first book.
I just had utter faith in my doctors. I had faith in science. I had faith that medical technology has advanced far enough that cancer can be managed. If not entirely cured, it can be managed like a chronic disease. My mission is teaching. My mission is communicating. And I believe I survived my 2 incidences of cancer because I knew in my heart that I wasn't done. I still have students to teach. I have lives to touch. I have books to write. And I have lessons to share.